Hello, hello, hello. Welcome now, Stock Trades. In this video, we're going to go ahead and react to this Clover Health streaming. We're going to have this video split up in two parts. The first one will obviously be get the data, acquire the data. And then I want to basically see your comments down below and questions that you have in wanting to understand or things that you would like to essentially clarify. And then we can go ahead and analyze the science and the educational background behind the diabetes prevention and the chronic kidney disease and essentially the Clover Assistant showcase that we just had today. So here's the video, and please let me know your questions down below. Thank you.
This is why we built Clover Assistant. When we launched CA in 2018, we already saw a world where there was vastly more data and information about patients than could be utilized by the average primary care physician. But we also realized that we had tools like the cloud and AI that could be used to synthesize that vast amount of data into a form usable by clinicians. And when we do that, what we see is that we give doctors superpowers. The same doctor, when aided by Clover Assistant, can detect disease earlier and manage disease earlier. We believe that this will lead to patients having longer and happier lives, doctors improving their practice of medicine, and society bearing lower costs. That's the holy grail of value-based care. That's what we're all about. And we believe that's what we're enabling in the real world today. Let me give you a simple example to set your intuition about how Clover Assistant can help. Imagine a patient, Mrs. Smith, walking into the office of their primary care physician, Dr. Jones. They complain of having problems with blurry vision. When that happens, Dr. Jones will work up Mrs. Smith for blurry vision, maybe actually just refer her to an optometrist for a visual acuity check. However, when Dr. Jones uses Clover Assistant, our AI-powered platform shows them a reminder that Mrs. Smith is diabetic. But not only that, it shows that while Dr. Jones has prescribed metformin, a diabetes medication, Mrs. Smith has not picked up that metformin for over 3 months. Now, armed with that insight, which is not in many doctors' EHRs, Dr. Jones might take a completely different course of analysis. Rather than referring Mrs. Smith for vision issues, they may now suspect unmanaged blood sugar, order additional labs around that, and have a conversation with Mrs. Smith about why she's finding it hard to stay on her medication. The timeline of care has completely changed. This feature exists in Clover Assistant today and is already helping our doctors manage medication adherence. Let me give you another simple example around our recent white paper on chronic kidney disease. CKD is a prevalent disease of aging, and the earlier it is caught and managed, the better. What we saw was that even when there were indications of potential CKD stage 3 in the eGFR lab results of a patient, those lab results were not always being shared across health systems and across EHRs. That means that oftentimes the primary care physician was not able to readily access those labs and wouldn't know their results. By using Clover Assistant, our AI-powered platform can access this data, clean it, and prioritize the most important parts, like these lab results, to surface to PCPs when it needs their attention. And when we do that, we enable those PCPs to order critical follow-on lab testing and diagnose stage 3 CKD as they deem appropriate and much earlier than they otherwise might. Earlier identification here enables earlier management and preserves kidney function. These are just a couple of examples of the hundreds of features that we've shipped in Clover Assistant in the last few years. As a technologist, I'm thrilled that by deploying our software platform into the heart of a managed care organization, we've been able to bring the power of big data, the cloud, and AI immediately to use, and to start safely and effectively assisting physicians to deliver better care. And because we own and operate our own platform from end to end, we can assist any physician at any health system, no matter what their EHR, their back office, or their technology tools might be. Now, we'd like to share a short video highlighting some of the extraordinary impact we've seen through the use of Clover Assistant.
Practicing medicine is as complex as ever. With the constant influx of new data, clinical studies, therapeutics, and payment models, all coupled with an aging population and mounting physician shortage. Further, with the advent of value-based care, it is harder than ever for physicians to deliver better outcomes to patients while simultaneously managing overall costs. Fortunately, technologies like the cloud and AI can help. That's why we created Clover Assistant. Thousands of clinicians are using data-driven insights generated by Clover Assistant to improve care management and coordination for tens of thousands of patients. At its core, Clover Assistant empowers clinicians to identify and manage chronic diseases earlier, supporting clinical decision-making and helping to accelerate the timeline of care, so patients can stay healthier longer. Based on a patient's unique health history, Clover Assistant surfaces evidence-based, personalized treatment plan recommendations for the clinician to consider and enables them to improve their patients' adherence to prescribed interventions through surfacing data typically unavailable to them in their EHR. With Clover Assistant, clinicians are also prompted about preventive care or follow-up care that may help the patient avoid more serious disease progression. Clover Assistant's user interface is simple by design and is adaptable for all practice types so that all clinicians can rapidly access information that supports earlier and more comprehensive patient care. But underlying the simplicity is sophisticated AI technology that gets smarter with every use and is built to quickly leverage technological advancements in generative AI, data interoperability, EHR integrations, and more. Clover Assistant empowers clinicians by curating data from across the healthcare ecosystem and applying machine learning to this data to surface the most likely conditions each patient is at risk for, along with personalized treatment plan recommendations for the clinician to consider, all to support clinical decision-making for better care management. With a robust view of each patient's medical history and potential health needs at their fingertips, clinicians are armed with timely and relevant information to make the most of each patient interaction. What does this mean? The potential for more timely and efficient care, which can help lead to longer and happier lives for patients, empower clinicians to improve their practice of medicine, and generate cost savings for society. Clover Assistant, built for every clinician looking to deliver patient-centric, value-based primary care.
We're obviously very excited about the impact Clover Assistant has already had and all the potential yet to be realized. To take us a level deeper on Clover Assistant features and functionality, allow me to introduce you to our Chief Technology Officer at Clover, Conrad Way.
Thanks, Andrew, and hello, everyone. Thank you for joining us today. As you saw, Clover Assistant is not just another documentation or administrative tool, but a groundbreaking solution that empowers clinicians with insights to better care for their patients. Our multidisciplinary team of clinical and technical experts works together to rapidly build, deploy, and enhance features to better serve the needs of our clinician network and members alike. To this point, Clover Assistant was built for doctors, by doctors, to meet their needs. Today, I'm thrilled to welcome members of the team to share more about how CA combines the power of data, clinical best practices, and advanced technologies to help improve the timeline and quality of care. First, please welcome Dr. Kumar Dhamarajan, a geriatrician and cardiologist, adjunct faculty member at Yale School of Medicine, and Chief Medical Officer of Clover Assistant, to help demonstrate how CA leverages data and AI to help support early diagnosis and improve treatment of chronic health conditions.
Thanks, Conrad. At Clover, I've used Clover Assistant, or CA, with my patients for more than 4 years. At its core, Clover Assistant is a clinical tool that helps support early diagnosis and improved treatment of chronic health conditions. To this end, we've developed more than 100 machine learning models to leverage the power of AI to find clinical patterns and relationships that might not be evident to busy clinicians. I'll build off Andrew's earlier example and showcase Clover Assistant's capabilities to help promote early diagnosis and improved care for chronic kidney disease, or CKD. CKD is a common health condition that is often undiagnosed and untreated, especially in minority populations. Without treatment, CKD is more likely to progress and result in complications such as heart attacks, end-stage renal disease requiring dialysis, and death. To help clinicians diagnose CKD and track its progression, Clover Assistant links in clinically relevant supporting evidence that doctors might not otherwise be able to efficiently find. For example, it may surface a claim for CKD stage 3A from a specialist with a hyperlinked note. When the link is clicked, the note opens to the exact page and section that is most relevant for the doctor to review, in this case showing the kidney disease treatment plan within an endocrinologist note. Our use of AI-based natural language processing for unstructured data makes this possible. CA also links in lab data from multiple sources like LabCorp, Quest, and information exchanges such as Commonwealth and Carequality. This information can extend well beyond the data in the doctor's EHR, which is usually restricted to the local practice. This gives doctors greater visibility to key data points that drive better continuity and coordination of care. We always try to make data clinically valuable to the question at hand. In this case, we're presenting data most important for kidney disease evaluation, in particular the glomerular filtration rate, or GFR, and urine protein results. Having the right information at the right time is often a pain point for doctors that we want to address. In this case, the doctor can see that the patient has progressed from CKD stage 3A, the previous diagnosis, to stage 3B, which is a more advanced stage of kidney disease. And that's because the GFR is now lower and in the 3B range. In addition, the urine protein is very high, showing significant kidney damage. This data we're surfacing to doctors is increasingly augmented by AI. For example, pulling in key insights from unstructured data such as a doctor's note. We're excited that recent advancements in this space enable us to surface insights based on personalized treatment logic. We're working to ensure that Clover Assistant safely takes advantage of generative AI's benefits in a way that supports but does not replace physician decision. Once a diagnosis is confirmed by a clinician, our goal is to translate it into improved care. In this case, after a clinician confirms a diagnosis of CKD stage 3B, Clover Assistant will ask them to consider different options to manage the condition, highlighting that treatment guidelines suggest the patient be started on an ACE inhibitor or angiotensin receptor blocker medication, or ARB. In appropriate patients, ACE inhibitors and ARBs slow CKD progression and reduce its complications. Importantly, before offering this treatment guideline, CA considered the patient's CKD stage, urine protein levels, comorbid hypertension, and serum potassium level, all in the background. For even higher risk patients expected to have rapid progression of their CKD, Clover Assistant may additionally ask the clinician to consider further testing or referral to a nephrologist for specialist care, as you can see here. In this instance, as well as others, we want to clearly describe the logic behind our recommendations, which were developed by our team of clinical leaders. We know that doctors value this transparency. While I've focused on CKD in this example, our goal is to help promote early diagnosis and improved care across a wide range of chronic health conditions, including diabetes, cardiovascular disease, chronic lung disease, depression, dementia, and many others. As a technology platform, Clover Assistant is built to improve care in a scalable way at the speed of software. We look forward to sharing more with you today.
Thanks, Kumar. I'm heartened by the outcomes we're driving for real patients through Clover Assistant's ability to help support clinicians in effectively managing chronic conditions earlier, before they become more serious. AI has been core to Clover Assistant from the beginning. The premise behind CA has always been to use advanced technology to synthesize vast amounts of disparate health data into personalized clinical insights that help improve patient care. As such, we are extremely excited that recent advancements in LLMs, foundational models, and generative AI enable us to continue bringing even more benefits afforded by AI capabilities to clinicians. What Kumar shared is just one of the many features intended to help clinicians maintain a comprehensive understanding of their patients to support early diagnosis and treatment. Another hurdle in providing great care stems from the fragmentation of the current healthcare landscape. What happens in one care setting doesn't always reliably make it back to other members of the care team, resulting in disjointed or duplicative care, or even worse, potentially life-threatening medical mistakes. In fact, we've heard feedback from physicians that they've come to rely on CA to surface, in a tightly summarized manner, what's going on with the patient outside of their own interactions. To demonstrate how CA's timely clinical insights can help promote improved care coordination and management, please welcome Dr. Jessica Sun, a practicing internist and chief medical officer of Clover Home Care.
Thanks, Conrad. Clover Home Care supports patients with home visits through a team of physicians, nurse practitioners, nurses, social workers, and medical assistants. Unfortunately, healthcare data is often siloed, making it difficult to access and use to improve patient care when it's needed most. To help solve this concern, Clover Assistant aggregates, deduplicates, and consistently refreshes data from well over 100 different sources. With this information, CA simultaneously drives insights at the population level to identify patients who are in need of focused care, and at the individual level to guide impactful interactions at the point of care. At the population level, CA has dashboards to show quality measure performance for doctors' entire Clover patient panel, as well as for individual Clover patients. These dashboards make it easy to drill down on performance by medical group, doctor, or quality measure within CA. Doctors and population health teams no longer need to export and manage large spreadsheets to track performance improvement opportunities, which has been the norm to date. Let's look at hospitalization. Many of our patients have expressed that one of their goals is to remain home as much as safely possible. Timely post-discharge follow-up has been shown to lower hospital readmissions. CA provides a dashboard of both recent hospital admissions and discharges, which provides timely signals for more than 90% of hospital stays for our Clover Medicare Advantage plan members to help us proactively support transitions home. CA's clinical insights can be even more impactful when shown to physicians at the point of care when they are directly interacting with patients. For example, in addition to flagging that a patient was recently hospitalized, CA will directly hyperlink to written material describing the hospital stay, such as a hospitalist note or discharge summary, which often contain critical pieces of information relevant to supporting patients post-discharge, but are difficult to obtain in real time. Too often, hospitalizations are black boxes to outpatient clinicians. Without understanding key information about the hospital stay and the expected treatment plan, outpatient physicians are less able to coordinate care and prevent adverse outcomes like hospital readmissions. Another preventative measure enabled by CA includes understanding medication adherence. Studies have shown that a large percentage of Medicare patients have difficulty with this at some point under coverage, whether because of cost, convenience, side effects, or otherwise. Yet, physicians rarely know when their prescriptions go unfilled. CA helps clinicians understand when patients are not picking up their prescriptions so that they can have a conversation to understand what the barriers may be. And we're working on ways to leverage the power of generative AI to help clinicians facilitate these discussions using information that is specific to the patient, such as their comorbidity profile and lab test results, as well as the medical literature related to the medication in question. And as Andrew mentioned earlier, we are seeing that surfacing this information in CA is already helping our doctors better manage medication adherence, which can translate to better chronic disease control, higher performance on quality measures related to medication adherence, and enables a greater understanding of the many factors that influence a patient's ability to follow a care plan. In response to physician feedback, we've started surfacing lab test results since the last CA visit. Physicians are often unaware of results of diagnostic tests ordered by other clinicians, which may result in duplication. We want to close that gap. We've added these results to pre-existing data points we show, such as patient's updated medication list and chronic condition profile. Our goal is to help physicians provide better care by giving them valuable and actionable data. We have many more clinical insights coming and look forward to sharing more in the future.
Thanks, Jessica. As you can see, Clover Assistant is breaking down data silos to aggregate and synthesize information so that clinicians have the information they need to care for their patients. However, this information is only useful if clinicians can readily access it. We're proud of our web-based application that can get practices up and running in a matter of minutes. But we're equally excited about our EHR integrations that enable us to embed CA directly into more clinicians' workflows. Our goal is to continue introducing functionality that lets clinicians spend more time focusing on their patients and less time behind the screen. I now welcome Kevin Holub, Vice President of Product for Clover Assistant, to share more about CA's integration capabilities.
Thanks, Conrad. As you've just seen from Dr. Dharmaranjan and Dr. Sun, Clover Assistant is designed to be a powerful tool to support clinicians in the management of complex Medicare patients. However, none of the features and insights matter if they don't get used. That's why we've put extensive focus on designing CA to fit into practice workflows so that our proprietary insights can help clinicians render better care and, in turn, lead to healthier patients. Because of these efforts, a large percentage of Clover members already see clinicians who use CA to help manage their care, ranging from solo practitioners to large integrated delivery networks. Clover Assistant started as a standalone web application to allow clinicians to rapidly unlock the power of its insights, and has evolved to include tablet-optimized experiences, paper-based workflows, and importantly, deeply embedded EHR integrations, increasingly meeting clinicians where they are. Our adaptable platform supports a wide range of workflows, including AWVs, telehealth visits, and more. CA supports bidirectional data syncing from and to the EHR, streamlining workflows and documentation. We pull in data directly from the EHR, including labs, medications, diagnoses, documents, and more. We then combine that with the universe of additional data Clover Assistant pulls from, creating a superset of available data for the PCP. All of this runs through our 100+ machine learning models. We combine, deduplicate, and prioritize the data based on sources, so users see their most trusted data first. One of our most common EHR integrations is via Athena Health's EHR. As you can see here, I'm in the context of a patient. In order to help identify when a patient is eligible for a Clover Assistant visit, we flag all Clover patients here and here. Since we're launching from the EHR, no additional prep is needed. Within the EHR, you can see that we have a fully embedded application allowing users to go through their visit with Clover Assistant alongside their EHR. We've heard from our physician users that bringing together the synthesized data in the context of their workflow has given them visibility into the care provided beyond their four walls. One physician shared that this helped them prevent a potential medical emergency by flagging conflicting interventions. which can occur when the care teams are not aware of the patient's entire medical status and is the unfortunate reality given the siloed natures of many clinicians' EHRs. Once the clinician is finished going through Clover Assistant, the work from CA pushes into the body of the progress note within the EHR, removing duplicate documentation. As we continue to deepen our integrations and bring transformative technologies directly to clinicians' workflows, we're looking to add capabilities like ambient scribing powered by generative AI and the ability to append orders from CA for medication updates, lab tests, and referrals, all with the goal of reducing the time spent on documentation and creating more time for clinicians to focus on what matters most, the patient.
Thank you, Clover team. I hope that this look behind the scenes of Clover Assistant helps highlight how CA is already assisting thousands of clinicians in the care of tens of thousands of patients. Clover Assistant not only curates data from across the healthcare ecosystem, but goes a step further to surface actionable clinical insights and recommendations to support physicians in improving health outcomes and curbing medical costs. It's taken significant time and an investment to build this platform, and we're now at a very exciting phase where we are rapidly realizing the benefits of Clover Assistant, as well as continuing to accelerate the development of its capabilities. Thank you all again for being part of this journey with us.
We will now move to the live question and answer portion of the event. As a reminder, if you'd like to submit a question at any time, you may do so by using the Q&A text box at the bottom of the webcast player or by emailing your questions to questions@lifesciadvisors.com. We will first take questions from Clover's research analysts and then open it up to questions submitted online, time permitting. We ask that you please limit yourself to one question and one quick follow-up. We'll take our first question from Richard Close from Canaccord. Please go ahead, Richard. Richard, you may be on mute.
Can you hear me now?
Yes, we can.
Okay, thanks. Sorry about that. Can you, I was curious if you could talk a little bit about the adoption trends. You've talked about thousands of physicians. Can you give us any type of, I guess, commentary with respect to, has adoption accelerated over the last couple of years? Just any type of details would be helpful.
Yeah, thanks for the question, Richard. So we've discussed a lot that we are doing a lot to make sure that the technology can be easily used by as many physicians as possible, and we feel really good about that. A lot of the features that we discussed today, particularly in Kevin's section around EHR integrations, have made it easier for more doctors to come online, and we feel good about that as well. And at this point, the majority of our membership does receive a Clover Assistant powered visit during the year. So that feels really good. So I think that we're in a great place where, on the one hand, I feel very good about the adoption we have. And as we bring on new membership, that new membership will be able to access Clover Assistant powered care. And if on a second dimension, even though the majority of the membership does get a Clover Assistant powered visit, I still also feel good that we are able to actually increase that number. And there is room for the team to improve how many of those visits are occurring. And of course, that drives better care in the population and will drive improvements in the business MCR as well. So we are able to improve via just improving that coverage number within the existing POP. But I also feel that all the features we've talked about today will accelerate adoption even further going forward.
Okay, and as a follow-up, with respect to electronic health record integration, you've highlighted Athena in the past. and it's interesting to see that tight integration in the demo. Can you talk a little bit about the timeline on other major electronic health records, and specifically like the Epic and Cerner?
Sure. And so I'll hand that over to Kevin to discuss the answer to that question.
Yeah, thanks for the question, Richard. So CA is built on FHIR standards, which is a set of rules and specifications to exchange electronic healthcare data. That means that CA has the technical foundation to integrate with any FHIR-enabled EHR. That said, each EHR integration is nuanced. It brings its own complexities, and we're working through those. Today, we have integrations with Athena, Epic, and Veradigm, and we're actively working on other integrations, and we'll share more as we make that progress.
Okay, thank you.
Thanks for the questions, Richard. Our next question comes from Ben Rossi from Citi. Please go ahead, Ben.
Hi, everyone. Thanks for taking my question and appreciate the additional commentary here on Clover Assistant. So thinking about patient data compliance and security, with your data transfers across platforms, how are you accounting for data compliance, and what have been the biggest barriers to sharing data across potentially competing providers? And then with the uptick in patient data breaches, how are you approaching your IT security infrastructure and related controls?
Yeah, so I'll take some of that and then I'll pass it along to Conrad to add more color. But I will say that this is one of the great benefits, as we have a lot of technologists, myself being one of them, who are here at Clover. And one of the reasons why we do this at an insurance company is, one, we believe that the business model of insurance aligns our incentives to delivering better care at lower cost. But two, to your point, a very powerful thing is because we are a managed care organization, our job is to coordinate care for the patient across multiple doctors, across multiple sites of care. So while it's much harder for other technology companies, they would have to sell software to lots of different places. One of the reasons why I myself, I'm here at Clover is we sit at that nexus of care as the payer, and we take that data in, and our job is to then distribute that back out to everybody else, right? And to make sure that it's managed care, right? Like the managed care organization. And so I will then pass it to Conrad to add any additional color as well.
Yeah, thanks, Ben, and appreciate the nuanced question. We definitely take security and privacy tremendously seriously at Clover, and as Andrew mentioned, our upbringing in the technology space sort of bolsters that. And some of the things that I would call out are things like automated phishing and security awareness. We have advanced ways of separating sort of different data sources in the cloud and through containerization and otherwise. And maybe one other one I'll call out is around sort of just the consistent vulnerability scanning that we do on our side as well.
Got it. And then as a follow-up here, just as you work to enhance and deploy new features that cater to your participating physicians, what are some sample features that you've added in response to physician feedback? And then as you add new features, are you getting any pushback on the complexity or number of data inputs?
Sure, yeah. I'll actually pass this along to Kumar, who is a physician himself and uses Clover Assistant, and then I'll ask Kevin to jump in for any additional feature color. So Kumar, please.
Thanks, Ben. So, one of the things we do is we constantly work with our physician users to understand their preferences, areas for innovation within the tool. For example, you asked for some specific examples. Over this summer, we started integrating labs from other doctors into a unique section in the tool. So a doctor could see the results, let's say, of a blood test for diabetes or kidney disease from another doctor, even if that doctor was not on the same EHR. We have connections with companies like Quest, LabCorp, health information exchanges, direct integrations with EHRs, et cetera, that allow us to pull that data from other sites of care. In addition, just as another example this summer, we've been flagging doctors to instances that their patient has been hospitalized because they've told us that they want that, as well as providing them some documentation from the hospital stay itself. So as a clinician, sometimes you know your patient is hospitalized. You're not really sure what happened during that black box of hospitalization. Why were they there? What they were treated with? How do they look on discharge? Who are they supposed to follow up with? And this summer, we've launched providing that data back to our physician network. And we're able to get that data in a number of ways. Kevin can certainly comment on that in more detail than I can. But it's something we do. We have a team of employees that work with doctors, that listen to feedback, and on a weekly basis, we process that feedback and have that influence our product roadmap. Because we know we're not perfect, but our goal is to constantly get better and better and provide true clinical value to clinicians. Kevin?
Yeah, happy to add a little bit of color there. So as Kumar indicated, we do spend a lot of time as a product and development and research team working on this. So one of the things that we do is we have a research team that really has a product feedback group that are representative Clover Assistant physicians. It's a forum where those physicians can provide realistic and critical feedback to the product, to the roadmap, the things that we're working on to make sure that it makes sense for them and what they're doing. We also do have the benefit of users like Jessica, users like Kumar that are internal to the company that give us real-time feedback as things are being rolled out. And additionally, we have a customer success team that is constantly on the street, in the practices with those offices, getting that feedback and sharing that back to us in a very closed loop way, so that our product team is never far from the feedback of those users. And finally, one of the things that we focus on is we know that asking for just one more click is a really big ask for any physician. So to your point, we focus a lot on not just saying, okay, here's 45 more things that we're going to ask and show you, but instead saying, here's the one key insight, the reason that we're making those sets of insights, and the quick action to get to that outcome. You saw those treatment recommendations that Kumar highlighted. That's an example of that. That's one click for an extremely complicated set of analyses. And it's so critically important for us that we make that one click as we design the product.
Great. Thanks for the questions, Ben. Our next question comes from Gary Taylor from Cowen. Please go ahead, Gary.
Hi, good morning, or afternoon, I guess, depending on where you are. I wondered if we could talk just a little bit more about physician adoption, if there's more detail. And I'm just thinking about, Andrew, you'd said majority of enrollment has at least one CA-powered, visit a year. I would imagine a huge part of that's the annual wellness visits. Like, could you describe maybe what it looks like excluding just those visits, or is there any other thing you're tracking on, like time physicians are actually engaged or online using it, or net promoter score, or anything like that? And then final would just be how much difference is utilization on the via portal versus when it's embedded? Is there anything observable about use and adoption between your MA network and your direct contracting network?
Yeah, lots of embedded
lots of parts to that. Yeah. So
Yeah.
any of that that's at hand that you think would be helpful or useful to us, we'd be interested in.
Yeah. Thanks, Gary. So a couple of different things, and I'll pass it to Conrad in a moment to add more color. But one thing I'll note here is that something we're really proud of is that Clover Assistant is designed to be used in multiple scenarios. Certainly, it can be used in an annual wellness visit type capacity, but I wouldn't say that the majority of our visits are in that capacity. Like we've spoken in the past, that what we really want to do is deliver targeted information to physicians on the basis of their normal E&M office visits, right? And that's what we're really focused on doing. So it's saying, hey, look, it's going to take 5 minutes, and here's the latest information for you to look at, versus a complete workup in a sort of an AWV mode. Now, if they want it in that AWV format, because that's easier for them, we're open to that. But we think that having it in more of that sort of GPS type mode, where we can give them more specific directions, is a much better way to use the products. But we do offer both of those options. The second thing that I will also indicate is that I think it's very powerful, and we gave some examples during the showcase video for our ability to say that we are looking to deliver care here as well, right? So annual wellness visits are about care, don't get me wrong, but what's really powerful is when you can say, hey, you came in for a certain reason A, like I always use migraine as the example, but you should consider looking at chronic kidney disease today, doctor. You should think about, in general, you should think about diabetes. And so the papers that we've put out, CKD a couple of months ago, and I would point everyone to the diabetes paper we released just today, and we put out a press release about that, indicate that we are actually pulling up the timeline of care through that earlier diagnosis and then earlier management as well. And so I think that's another thing we're very proud about, that is not necessarily driving with just the AWV context. So once again, AWVs have their place, but having care in the mind of the PCP, really important. I'll toss to Conrad for any thoughts about NPS, etc.
Yep, absolutely. And thank you for the question. I think to build on what Andrew said, actually the minority of our visits are through annual wellness visits. And we think that that's quite a differentiator compared to a lot of the other tools and processes out there, where we are actually able to drive longitudinal care. Another example along the lines of what Andrew talked about was a feature that we launched this summer, where we now flag more pointedly when we believe somebody is off of their medications or aren't adherent to their medications. And that's not something you can do once a year. That's something you have to do in the context of an ongoing longitudinal relationship that you have with your patient. And so we've actually noticed that after such Clover Assistant visits, you're more inclined as a patient to actually fill your medications and be managed for those chronic conditions. And so that's yet another example of how that coverage, maybe the top line number we find very impressive, but even underneath the hood, the fact that more visits are of this incremental nature, longitudinal nature, is equally impressive in our books and a big differentiator for us. On the NPS front, just to wrap up, we don't disclose specific NPS numbers, but what I can say is that compared to certain leading EHRs, that we are dozens of points higher in terms of the EHR that we measure compared to those EHRs.
Great, thank you.
Thanks for the questions, Gary. Our next question comes from Craig Jones from Stifel. Please go ahead, Craig.
Thanks. If we think about, I think in the past you talked about there's an MLR delta between patients that use Clover Assistant and patients that don't. And I was wondering, if we think about sort of as you've rolled out these software enhancements over the last few years, like how much improvement have you been able to drive in that delta? And then, I guess what could it get to eventually? Like, how do you see that trending in the near term? And then, could you list maybe some examples of like low-hanging software enhancements that you could, roll out in the near term that would drive that even higher?
Yeah, absolutely. So I will actually toss it over to Conrad to discuss that particular area. Conrad, go ahead.
Yep, absolutely. So definitely still see a tremendous over 10% MCR differential. And actually, while we don't disclose specifics here, we do see a favorable and meaningful impact on both the MedX and revenue side of the MCR equation, which we're very proud of. And that's because we believe Clover Assistant is first and foremost a care management tool. And if based on information surfaced by Clover Assistant, a clinician is able to detect that patient is dealing with chronic condition earlier than they otherwise would be in a position to, then we can help manage that condition, and that saves costs across the healthcare system and prevents unnecessary suffering. And so that enables us to see well in excess of 1,000 basis points, and we have seen that go up over time, and we continue to see that rise. Now, on the go-forward basis, to your other half of your question, definitely still believe that we're early innings here and that there's a lot more opportunity to affect care and increase further that MCR differential. For example, a couple areas that we're poking into further here are in expanding the depth of our treatment recommendations that enable our members to be on best practice or standard of care throughout their visits. Now, one other one that I'll call out is, there's a lot more that we can do to manage in between visits than we do now. We're very proud that Clover Assistant is the very rare healthcare technology tool that is used at the point of care by clinicians longitudinally across visits. That said, we've really leaned in there, and we think that there's actually quite a bit of what you call low-hanging fruit in managing those things outside of the context of care through care coordination teams and pop health teams and so forth.
Thanks, Conrad. And I will just add a bit of color here as well, which is we see both a revenue and MedX effect from Clover Assistant. Both of those appear. And I would just also note that MedX effects take time to emerge within the actual claims experience, right? Like if you have a informed, visit and you diagnose something like CKD for the first time, even if you start medication that day, you aren't going to get a miraculous change in the MedX necessarily within a week. So what I think we're seeing is the effect of Clover Assistant, even if no new features were deployed, and we're of course deploying new features, but even if no new features were deployed, all of that effect of earlier detection of disease, better management, better adherence, all those things, then actuarially sort of flows into the claims experience over time, over probably certainly months, maybe quarters, maybe years. And as those people stay with us, we then enjoy a better and better and better MedX experience versus benchmark from that point onwards. So that's another dimension of this that I just wanted to make sure we call out.
Thanks. That makes a lot of sense. All from me. Appreciate it.
Thanks for the questions, Craig. This concludes the verbal portion of the Q&A session. I'll now turn the call over to Ryan Schmidt, Clover Health Investor Relations, for the questions that have submitted online. Please go ahead, Ryan.
Thanks, Tara. As you just said, we'll switch over to some of the audience submitted questions. Our first question is, what is Clover Assistant's technical advantage compared to other technology in healthcare? Andrew, do you want to take that one?
Sure, thank you for the question. So number one, and I briefly alluded to this, but it's really important and easy to overlook, but the background of our leadership team, our technology leadership team, is very different from those of other managed care companies. Like if you look at even my background, right, as the CEO, I have an R&D technology-oriented background. I founded a company. I've sold companies to Google. And then, we have deep experiences in AI, ML. So these are not new concepts for us. It's very intuitive for us to take our technology experiences and apply them to healthcare, right? And I think that that's really important when you compare us to other managed care companies. When you look at us compared to other technology companies, if you ask any healthcare technology leadership, people who come with similar backgrounds to us, you'll see them just being so frustrated, banging their head against the wall, saying it's so hard to get into sell software to healthcare, so hard to get payers to cover software. Like how many times have you heard about a promising technology that just can't get coverage or be paid for by payers, or cannot just get adoption because they're selling into the CIO of a health system? Our unique sort of business model coming from the payer side lets us take that technology, pair it with a way to deploy into the industry where we are at the center of that because we are a managed care organization. And then those two things together let us increase the adoption and usage of Clover Assistant. So everything you're seeing today, everything you're on the videos and our discussion is either actively in use or imminently going to be released soon to actual doctors and going to be used by actual doctors in our network, driving that MCR differential, right? This is not theoretical application, but it flows directly into the business. And then when it does that, we get that active feedback that Kumar and Kevin were talking about that help increase and improve the rate of development and adoption.
Great. Thanks, Andrew. Our next question is, what is the value proposition for the physicians and how are these capabilities communicated to the patients? Conrad, do you want to take that one?
Sure. Let me start off, and Jessica, I'd love if you built on my response as well. So, look, it's no secret that clinicians are overworked and that our country has a growing PCP shortage already today. And so that's why through Clover Assistant, we're trying to provide this actionable, evidence-based data for clinicians to help them connect more with their patients on a human level. And what we believe this looks like is spending less time digging around on a screen in the encounter, or even worse, during their pajama time, and more time making eye contact with the patient, explaining potential health decisions. And on the flip side, for communication to members, we think the benefits of Clover Assistant-powered primary care are best encouraged through many different ways, not least of which is through our Live Healthy Rewards program, which rewards them for receiving a Clover Assistant-powered clinical visit. And our goal is to get all of our members receiving this type of powered visit in order to address any of their unmet needs and to support all of our members in identifying and managing chronic conditions earlier so that they can potentially live a longer, happier, and healthier lives. Jessica, do you want to build on that?
Sure. So we've spent a lot of time building both Clover Assistant and Clover Home Care and integrating them within our practice. Both are driven by our strong conviction that when we better understand and support our members' needs and deliver care when they need it the most, we will see materially improved outcomes for our members. Personally, as a physician, I believe in CA because it lets me be a human with a patient. And most of medicine has been dehumanized. CA enables me to restore the humanity of medicine, sitting on the couch next to a patient, being given data that is actionable and relevant in that moment. It really lets me be a doctor to my patient again.
Great. Thanks, Jessica. We only have time for one more question. So to close this event, we will end on where would you say Clover Assistant sits in its overall evolution? Andrew, do you want to take that one?
Yeah, absolutely. So it's obvious that we are in early days of Clover Assistant. We've worked really hard to get the platform in place, to get the data flows in place, to get the adoption by physicians in this very differentiated way out in the environment so we can, that's really the hard work of this, right? And now we're seeing that flow into the business results, as Scott and I have discussed at earnings. We're seeing that flow into the business results in an active way. Now it's a very interesting, I think, fun period where the technology team can develop new features, roll them out, know they have users. We're going to get more users, but know that we already have users, see those results. And just like Jessica was talking, we have our in-home care, our PCPs using it every day. We have our wide network teams using it every day. And now when you layer on the fact that we have ML, and we always like to use ML internally, but AI, so sort of like baked into our DNA, as it were, and lots of our features are powered by that. All these advancements from the field, like we're not going to go out there and build, I don't think we're going to go out there and build our own large language model anytime soon. That doesn't make sense. But as we see all of these things be built out by other people in the industry, it is going to be so difficult for people to bring that to actually help patients and actually help doctors and have it be used. That's going to be where the bottleneck is. It's not in the concept or the idea, it's the actual usage. And we have solved that. So we have like a fast track express lane to getting features so that they can help, and AI features that are helping and assisting doctors all day long to deliver better care. And as that AI tide lifts, it will not lift all boats. I think it will just lift Clover Assistant really quickly, while others will be trying to figure out how to get it out and deploy, right? So we've solved the hard part first. Now we're going to deploy new features, AI-powered features, I think at a rate that is significantly faster than industry. Always safe, of course, always compliant, keeping patient safety in mind. But that's going to be a really, really exciting time.
Great. Thank you, Andrew. And that concludes the Q&A portion of the Clover Assistant Showcase event. Andrew, I'll give it back to you for any closing comments.
Yes, thank you everyone for joining us today for our Clover Assistant Showcase. Thank you so much to the team who worked really hard on presenting the material today, and thank you for the analysts who joined us today, and to our broader community joining in and watching the stream. So we really appreciate that the interest, the support, and I think that what you'll see is that we are at a phase of Clover, as I just said, which is very exciting. We're at a phase where, as a country, the need for change within our healthcare system, but distinct technology-powered change, has never been greater. And I think you are seeing that Clover is extremely well placed to be a key participant, a key leader in that particular drive towards changing healthcare. And that is on a macro basis, because as we look at how we help as many people as possible within the Medicare industry, I think that's really, really important. And that's on a personalized micro basis, where the ability to even just find diabetes just a little earlier for just one person changes that person's life. It changes the timeline of their care. It changes the arc of their family, right? And so I think that as we look at what Clover can do, as we look at what Clover Assistant will do with AI and all the technologies coming online, it is balancing that out so that when we help that one person, we know that we're not just helping one, we're helping a lot of people. When we look after someone within our home care practice, we know they're amongst the sickest people who are on Medicare. And then within our population, we know that we're changing the arc of their lives within Jessica's group, powered by Clover Assistant technology. When we look at those changes that we bring, and then we can say, wow, that's making a huge difference. And for us to also know that we have a business model that aligns to those changes, that when we use technology to help those individual people, that in aggregate, it makes us completely differentiated from a managed care perspective, that we can deliver fundamentally different economics on a wide network, as I've talked about many times at earnings. That is a huge difference, and I'm incredibly excited. So thank you for everyone for joining today, and we look forward to sharing more coming soon.